States, healthcare is not equally accessible. Where you live, what you earn, and the color of your skin can determine whether you receive care or simply go without it. These disparities are not new, they are systematic, persistent, and deeply rooted in our healthcare system. Low income, rural, and minority populations face the greatest barriers. Despite reform like Medicare, Medicaid, and the Affordable Care Act, access to affordable care remains uneven. Structural inequities continue to drive poor health outcomes. Rural hospitals are closing, medical debt is rising, and chronic conditions go untreated not because of the lack of knowledge, but because of the lack of access that we have in our communities. HEAAA, the Health Equity and Affordability Advancement Act, is a bold policy proposal designed to close these gaps. It introduces targeted subsidies to help low income patients afford health care. It ties the community with reimbursements to equity outcomes, rewarding those who marginalize communities. It invests community health infrastructure, bringing care closer and closer to those who need it. Nonprofits, advocacy, community health workers. HEAAA is backed by a coalition of stakeholders, federal agencies like CMS and HRS, nonprofits like Families USA and the Robert Wood Johnson Foundation, and academic leaders from National Academy of Medicine all recognize the urgency. But the partisan support and public engagements are essential. Equity is not a partisan issue, it is a human issue, an issue that we all face on a day to day basis. HEAAA could dramatically improve access and outcomes. It may reduce chronic disease rates, lower hospitalizations, and ease the burden of medical debt. But it also faces challenges, administrative challenges, complicity, political resistance, and a risk that providers may avoid high risk population if equity metrics are poorly designed. Success will solely depend on implementation and sustained funding. But there's hope. There's hope for all. Health equity isn't just a policy goal, it is a moral imperative. The Health Equity and Affordability Advancement Act offers a path forward, a path towards fairness and dignity, and a better health for all. The time is now to act to support this cause, close the gap, and help save lives. Patients, providers, and families are all looking for a change. Behind every statistic is a story: a mother skipping medication to pay rent, a rural clinic struggling to stay open, a provider fighting to serve their community. The Health Equity Affordability Advance Act isn't just a policy, it is hope. A hope for a system that sees every person's value, and deliver health care with dignity. Health equity is personal. Every life deserves care. Let's build a system that works for everyone, you and me, of all different nationalities.